question is, what can the listener do to reduce and eliminate that exposure to toxins?
Well, one of the things I tell all of my patients is to get some kind of a filter on their tap water. You know, people would be amazed if they called their water authority and asked for a list of all of the toxins. In fact, I did that when my mother was diagnosed with AML back 30 years ago. It was 3 pages of double columns of arsenic, heavy metals, contraceptives, prescription drugs. You would not believe what is in the water supply. So I think it's a great idea for everyone to get some kind of a reverse osmosis water filter on their tap. The other thing is really most people don't realize that on a typical day, you actually inhale about 20 milligrams of dust in a typical day inside of your house. So one good thing to do is, open the windows once in a while. People don't realize that the toxin level inside of your house is way higher than what it is outside.
That was Dr. Dominic Brandy, and you've landed on the Me&my Health Up podcast. I'm your host, Anthony Hartcher. I'm a clinical nutritionist and lifestyle medicine specialist. The purpose of this podcast is to enhance and enlighten your well-being. And today I've brought Dominic Brandy on the show to enhance and enlighten your well-being in how to prevent, survive, and thrive with cancer. That's what he does. He is a physician of 42 years and he specialized in plastic surgery and anti-aging. But then he was struck down with a multiple myeloma. And that really sent him for 6. And so he went deep down into evidence-based research around natural ways to beat back cancer. And he wrote a book on natural ways to beat back cancer. And he's got 5 scientifically proven ways to help beat back cancer so that you can not only survive but thrive with cancer. So without much further ado, I'd love to welcome you into this insightful discussion with Dr. Dominic Brandy. Welcome on the Me&my Health Up podcast. How are you, Dr. Brandy?
Hey, I'm doing great. I'm glad to be here.
Where are you joining us from?
Pittsburgh, Pennsylvania in the United States.
Yeah, fantastic. So great to have you on the show. We're talking about a very important topic, not only to you, but also to the listeners. We're certainly seeing rising rates of cancer. Everyone, a listener or, the general public just tuning into this will have some sort of connection with cancer, whether it be a family member or a friend, but we all have been affected by cancer in some way. And I'm really glad to have you on the show to share your expertise with the listener in terms of how they can prevent, survive, and thrive with cancer. So thank you, Dominic, for putting aside your time.
Hey, I'm glad to be here. Glad to share some good information with you today.
Let's start with your journey, how you've arrived at what you're doing today.
Well, a little bit of background about myself. I had a plastic surgery / med spa / anti-aging center for over 40 years. And 3.5 years ago, I actually sold it to a venture capital group. So the last 3.5 years, I dedicate my life to doing cancer lifestyle coaching for people that are really battling with cancer. But my cancer journey actually started about 6 years ago. I was diagnosed with an incurable blood cancer called multiple myeloma. And what's interesting about my story is the different avenues that I use in giving advice to patients and coaching them actually started 2 months before I actually got diagnosed. It was kind of weird the way that it happened. My wife and I were on a cruise. It was a 2-week Viking cruise. We were going across the Atlantic Ocean. And because I've always had this anti-aging center, I've always been interested in health and nutrition. So I've read well over 300 books on health and nutrition. So when I'm on a vacation, the first thing I do is I get on Kindle and I look for some kind of a health and nutrition book. So on this trip, this book by Michael Greger popped up, How Not to Die. And to say the least, the title was quite intriguing. And for anybody in your listening audience that's ever read the book, if you get the hardback, it's literally about 2 inches thick, and about an inch of it are scientific references. And being a medical doctor, as I was reading this, that was the thing that was really intriguing to me, is that the science was just showing over and over again that research cohort groups, cultures that ate more plant-based seem to have a much lower incidence of cancer, cardiovascular disease, diabetes, dementia, really all-cause mortality. So I'm a couple days into this cruise, and I tell my wife, I'm going to start eating whole food plant-based. And she thought I was out of my mind, but I've been eating whole food plant-based ever since then. That was September of 2017. So then I came home. This was like the last week of September, and I'm doing a surgical case, and I feel a little pop in my right clavicle. And I didn't think a whole lot of it. I thought maybe it was a tendonitis or something like that. And it just kept getting worse and worse. And then I remember by the end of October, so this is like about a month and a half later from the cruise, it was starting to keep me up at night, and the pain in the right clavicle. And I remember telling my wife, I said, Trina, you know what? I think I have bone cancer. And she said, oh, you're the healthiest person I know. You don't have, bone cancer. So I kind of sloughed it off, and the pain just kept getting worse and worse. So one day we were watching television. It was November 10th. I remember the exact day, 2017. I had a container of water, and I accidentally knocked it over. And when I lunged to catch it, my bone just cracked right in half. So I went to the urgent care center. They did an x-ray. I had a totally displaced clavicle. Then went to a friend of mine who's an orthopedic doctor. He did an MRI, and he called me the Friday after the Sunday that this happened. He goes, Nick, that's my nickname. He goes, Nick, I got some bad news for you. He goes, you either have a metastatic tumor in there or you have multiple myeloma. And, you can imagine I was totally devastated. I mean, my brother came over, my sisters, they were crying. It was like really pretty traumatic. And anybody that's been diagnosed with cancer, they know what it's like. Your whole world is completely rocked. So anyway, I had to then go get testing. They did a biopsy, a bunch of different blood work, and they came up with this diagnosis of an IgA kappa chain myeloma. And for your listeners, just so they know, there's basically three types of myeloma. There's IgA, IgG, IgM. And mine was an IgA, which is, if you go on the internet, that's the most aggressive type of multiple myeloma. So when I went to my oncologist, he wanted to start me on this triple regimen. It was 2 oral medications, and then there was a shot that I would have to get into my abdomen every week. And the more I was reading about this shot, it's called Velcade. It's a proteasome inhibitor. Almost everybody gets a pretty severe peripheral neuropathy, which is a kind of a destruction of the nerve endings of the feet and the hands. And because I'm a surgeon, that concerned me. So I told him I wasn't going to do the Velcade. The other reason I told him that is I had already been eating whole food plant-based for 2 months, and I felt confident that that was going to help me. So anyway, he wasn't happy, to say the least. He just didn't think I was going to be able to get into any kind of a remission just doing these 2 oral medications. So at that point, I kept eating whole food plant-based, and then I went on a deep dive into the scientific literature. I just wanted to find every single herbal supplement I could take, lifestyle changes that I could do that would enhance my chances of getting into a complete remission. So every month, my numbers just kept getting better and better. And when I got to 6 months, I was in a complete remission. To say the least, the oncologist was totally blown away. He didn't even think I was going to get into a complete remission, but to do it in 6 months, he was just, as I said, he was really blown away by that. He was obviously happy. But at that point, I kept doing research. And what I did in my med spas, I started to have monthly meetings with people that showed up at a large, I did a seminar. It was about a year after I was diagnosed. I rented a hotel room, and I advertised that I was going to give a lecture on cancer prevention and what you could do if you had cancer, lifestyle changes that you could make. And I thought I was going to maybe get 50 people there. I got 125 people that showed up at this lecture. And it was supposed to be about an hour. It ended up being a 2-hour lecture. At the end of it, I had a standing ovation, which I have never had a standing ovation for anything. I think it was because I don't think the lecture was that great. I think it was because there were a lot of cancer patients out there that really felt that they were at the mercy of the radiation, the chemo, the surgery, and there wasn't anything that they could do to enhance their outcome. In fact, after I gave the lecture, there were quite a few cancer patients that came up to me. And I remember one specifically, she had what I have, multiple myeloma, and she told me that, and she was definitely overweight. I would say she was even obese. She told me that she asked her oncologist if she should change her diet in any way. And he said, oh, no, just keep eating the way you're eating. You're going to do just fine. And she looked me right in the eye and she said, I knew that couldn't be right. And I had other people that came up to me, and it was the same kind of a scenario where oncologists really didn't give any recommendations on lifestyle changes, dietary changes that they could make, and so forth. So after I gave this talk, I decided every month I was going to have a meeting at one of my med spas. It was one of my larger med spas. And I would bring in guest speakers. I don't even know how we packed these people in. We were getting about 75 to 100 people packed into these monthly meetings, and they were really very, very excellent. And then people started asking me, you need to write a book, because I had all this knowledge. So it was Memorial Day, I remember, 2018. Every morning I woke up and I wrote for an hour. I had actually a writing coach, and she told me, I never knew this. She said, if you wake up every morning and you write an hour, an average person can write about 700 words in an hour. She said you can get a short book done in 1 month, a medium book done in 2 months, and a long book done in 3 months. So every morning, as soon as I woke up, I wrote for at least an hour. And then obviously I had to do a lot of research, in between, but I had the book completely done by Labor Day. And then I had it on Amazon the first week of November, and then I had a book launching the second week of November. So that's kind of how. And then I developed a website. I have an Instagram site. It's called Cancer Veggie Doc. I have over 97,000 followers on that Instagram site. In fact, right before we did this podcast, I did a post. What I do now is basically I do cancer lifestyle coaching for patients. If they go on the internet, they sign up either for a 1 or 2 hour virtual consultation. I really prefer a 2 hour. In fact, most of the time they run about 2.5 hours. I kind of really go over all the different aspects of what I think they need to be doing to augment either the treatment they're getting, or if they're in a remission, keeping them in a remission. And I can tell you, I had somebody on a podcast ask me one time, have you ever had any of your patients that were in remission come out of remission? And I really could not think of one that was following the protocol that actually came out of remission. So if they follow these lifestyle changes that I recommend and supplements and so forth, there's a really good chance that they're going to be able to stay in remission. Now, some of the patients are stage 4. They're kind of at the end of the road. In those kind of cases, I'll refer them to clinics that do IV vitamin C treatments, ozone treatments, even hyperthermia treatments. So when you start getting, into a stage 4 where the cancer really has taken off, then you really have to get more aggressive with some other type of treatments. But one thing that I don't do, and I want to make this clear to your listeners, is I do not tell patients to not get conventional treatment. In fact, I've run into some situations where I've had some very young patients. I have one in particular. She's 32 years old. When she was 29, she was diagnosed with breast cancer, and she tried the Gerson therapy for about 10 months, and it kept getting worse. And then she went to a clinic in Texas. I think she did methylene blue with ozone, mistletoe, and it just kept getting worse. And then she finally came to me, and I told her, listen, you need to do an integrative approach. In other words, you need to do conventional therapy plus all these different supplements that I'm going to recommend, dietary changes, exercise, good sleep, stress management, detox, and so forth. And she's doing really, really well now. But I run into a lot of patients that try to go the alternative route without doing conventional. And a lot of them really get themselves into major problems. So one thing I want your listeners to understand is that I do not recommend just trying to treat cancer with food and alternative treatments. I think you need a combination of everything.
Thank you for sharing your story. Very inspirational in terms of having, I guess, got the diagnosis and then really looking into everything possible that you could do to not only help you, but it seems to be helping everyone else or everyone that you touch around your coaching. So it's having a profound impact in terms of what you've learned through your journey, and now you're inspiring others that they can do a whole lot more. They can actually take their hands into, along with, as you said, conventional treatments, but they can do something around in terms of, doing something as opposed to thinking that it's reliant on someone else. They can actually take some ownership and do things around diet and lifestyle. So my next question for you, Dominic, is around the myths of cancer. And I think one of them is certainly around, like you were saying, that you're doing a lot around your health, and then you come into this, you got this diagnosis around cancer. And so, like I'm sure there's a myth around that, like healthy people are susceptible just as much as unhealthy. I'm not sure, but I'd love you to share the myths around cancer.
Well, first off, I do think that lifestyle does have a big part of whether or not you get cancer. I mean, we do know the National Cancer Institute in the United States, they recommend 9 servings of fruits and vegetables for the prevention of cancer. And the reason they came up with that recommendation is, as Dr. Greger showed in his book, when you look at cultures and you look at research cohort groups that eat more plant foods, they tend to have much less cancer. If you look in the United States, it's probably similar in Australia. The average person in the United States, there was a CDC study that I read, eats on average 1.8 servings of plant foods. And that's counting French fries and ketchup as a plant food. So we are severely deficient in the amount of plant food that we're eating. If you look at fiber, and fiber is one of the things I really try to focus on, especially when you look at fiber and its relationship to the microbiome, and we can get into that a little bit later if you want. But if you look at the United States, for example, only 3% of the population is hitting 25 grams of fiber. And men between 30 to 50, 0% are hitting 25 grams of fiber. Just myself, I eat plant-based. I eat about 60 to 70 grams of fiber per day. And I think we need to focus, if you focus more on the fiber and you get away from all of these, arguments on social media, carnivores versus vegans versus, ketos, paleo. I think if you focus more on the fiber and quit arguing about what diet is the best, I think people will start eating more plants automatically, because that's the only place really that you can get fiber is from plant foods. So I really do think in the United States, one of the reasons we've had a rise in cancer is we don't eat enough plants. But I think the other problem is, and I'm sure it's this way in Australia, about 70% of Americans are either obese or overweight. And we definitely know that when you are overweight or obese, your propensity toward cancer goes up dramatically. For a couple reasons. First off, that extra visceral fat creates a lot of pro-inflammatory cytokines that are very pro-carcinogenic. But the other thing, most people that are overweight are diabetic or pre-diabetic. And when you're diabetic, you have higher insulin levels, and you also have higher sugar levels in your bloodstream. And I think most people know, and all my cancer patients, when I tell them they can eat fruit, they're like ecstatic, because they always hear that cancer loves sugar. So they think, oh, I can't eat fruit. But when you're diabetic, your sugar levels are high and your insulin levels are high. And what most people don't realize is that insulin is one of the most powerful cancer growth stimulators in your body. So that when you have that constant insulin level that is elevated, and if you, let's say you have a DNA mutation that has occurred that is pro-carcinogenic, that could be a trigger for cancer growth. So you really have to keep your insulin levels down, and you really need to keep your weight ideal, because when you are obese, you definitely have a much higher propensity toward getting cancer. I think one of the other things in the United States, a lot of people drink alcohol. I'm sure that's the case in Australia. I know the Aussies like to drink their beer, right? But alcohol consumption, there's a lot of studies that are coming out that show that alcohol consumption, even moderate, is correlated with just about every type of cancer. So that's another area that I think, at least in the United States, where drinking alcohol is just kind of almost like drinking, water. It's just become just part of the culture. So I think that's another issue and why we're seeing an elevation. And I think the other thing is we're exposed to so many toxins nowadays. I mean, let's just face it. When you're eating your food, there's so many pesticides, even in the drinking water. One of the things that I do recommend all of my patients to do is get a reverse osmosis water filter on their tap. My mother was diagnosed with leukemia back in 1990. And I remember we had a filter company come in and they put 2 electrodes in the tap water and literally 33% of the water precipitated out. I mean, it totally freaked me out. So I called the water authority and I said, hey, can you send me a list of what's in the water? And it was like 3 pages of 2 columns. I mean, there was arsenic, there's contraceptives, prescription drug. You can't believe all the stuff that's in the water supply. So that's one of the things I tell all of my cancer patients. You need to get some kind of a filter on your tap water because you really don't want to have all of those carcinogens in your body, especially when you're trying to fight cancer. I mean, you're trying to fight it, then you're exposed to all these carcinogens. So I think that's the other reason why there's been a significant rise in cancer. I think it's a lot of the toxins. In fact, I read one article that by the time a woman leaves her home, when she puts her skin creams on and her makeup, she's already introduced 168 different chemicals into her body. And an average man already has introduced about 85 different chemicals into their body before they've even left the house. So I just think we're exposed to a lot of carcinogens also.
That was incredible in terms of what you just shared, Dr. Brandy, around the amount of toxins we're exposed to on a daily basis. And so my next question is, what can the listener do to reduce and eliminate that exposure to toxins?
Well, one of the things I tell all of my patients is to get some kind of a filter on their tap water. People would be amazed if they called their water authority and asked for a list of all of the toxins. In fact, I did that when my mother was diagnosed with AML back 30 years ago. It was 3 pages of double columns of arsenic, heavy metals, contraceptives, prescription drugs. You would not believe what is in the water supply. So I think it's a great idea for everyone to get some kind of a reverse osmosis water filter there on their tap. The other thing is really most people don't realize that on a typical day, you actually inhale about 20 milligrams of dust in a typical day inside of your house. So one good thing to do is, open the windows once in a while. People don't realize that the toxin level inside of your house is way higher than what it is outside. So it's not a bad idea. In our house, for example, we have an air filter in every single house. And I think that's especially important when you're sleeping. The bedroom is actually one of the most toxic rooms in a house. So it really would be a good idea to a minimum at least have an air filter running in your bedroom at night. And then I think the obvious thing that most people know is if you can eat organic, I think that is a good idea. I mean, we exposed to so many pesticides and also foods that have high glyphosate levels. So I would recommend when you buy foods, at least try to get ones that have a non-GMO label on them. And one of the things people don't realize is that when you eat meat, for example, 85% of those animals are actually fed GMO soy products and plant grain products. So when you're eating a lot of animal products, you're actually getting a lot of glyphosate. So, just cutting back on your animal products, as you know, I'm more into whole food plant-based, but if you are going to eat animal products, make sure it's grass fed. And if there's a way for you to find out if those animals are not fed any kind of GMO grains, for example. The other thing that I learned when I go to for instance, a Chinese restaurant, I typically order tofu with vegetables, for example, steamed vegetables. But I never even thought about this. I read about it in an article one day. I asked, is your soy non-GMO? because you would be surprised how many Chinese restaurants actually serve you GMO type soy. So it's always good to ask about those different types of things. The other thing I think people need to know is that it's impossible to totally eliminate all of your exposures. I mean, people don't realize since World War II, there have been 81,000 different chemicals that have been developed, and 71,000 of them are actually endocrine disruptors. So it's almost impossible to totally eliminate your exposure. So there's several things that I really recommend to my patients to really eliminate or decrease the amount of exposure. And number one is you really have to understand the way that your body detoxes. So your liver is your main detox organ. So you have phase one enzymes, you have phase two enzymes. The phase one enzymes basically take the toxin and they make it into a polarized chemical. And then the phase two basically take it from a polarized chemical into a water soluble chemical molecule. So from that point, we basically can get rid of it through our kidneys. So drinking a lot of purified water would be the best way to help get rid of a lot of those toxins. The other way you get rid of it is through sweat. So when you exercise, make sure you exercise to the point where you are actually sweating. And I strongly recommend that my patients really think about getting a portable infrared sauna. My wife and I, we basically get infrared sauna every night. We watch typically some kind of a TV series, and she gets in for 30 minutes. We pause, she takes a shower, then I get in for about 30 minutes. But it gets you up to about 175 degrees Fahrenheit. And when you sweat like that, the science does show that you get rid of a lot of these endocrine disruptors. They basically come out through your sweat. So that's something that I strongly recommend people think about, getting. And then the third way is through your intestines. So studies show that the higher your fiber content, the more you are going to get rid of a lot of these toxins. Fiber actually binds to a lot of heavy metals. So I recommend for my patients more of a whole food plant-based diet. So they're getting typically anywhere from 60 to 70 grams of fiber per day. So they're really getting rid of a lot of these heavy metals and toxins through the feces. So they're basically the things that you can do. Like I said, you're never going to totally eliminate your exposure. So the best thing to do is minimize it and then do whatever you can to help your body get rid of as many toxins as possible.
And what do you recommend about the exposure to chemicals through the application of skin creams and makeup? And so what's your thoughts on that and what people can do to minimize their toxic?
Yeah, there's a good website. I don't know if you're familiar with it. You probably are. It's called ewg.org. And they basically, when you go on there, you hit different categories. For instance, you hit skin creams, and it'll have all the skin creams that they've done analysis on. In fact, nowadays, and I don't know if it's this way in Australia, but they actually have an EWG verification on a lot of these skin creams, sunscreens, and so forth. So I think the ewg.org is a good place to go. They have different shampoos that are safer, soaps, etc. So that's something that I would highly recommend. And then even for cleaning products, my wife actually makes her own cleaning products. She uses like essential oils and vinegar to clean a lot of our tabletops and so forth. So, but on ewg.org, they also have different cleaners that you can use in your house that are a lot safer.
Oh, fantastic. And you just spoke about the fiber and the importance of that in eliminating toxins, binding to heavy metals and taking them out through our bowels. You mentioned before that much earlier in the episode around the importance of fiber linked to the microbiome. I'd love to explore that with you and the importance of having increased fiber to support a healthy microbiome.
Yeah, as we kind of talked before we started the podcast, on social media, there's all of these diet wars, I call them, vegan versus paleo versus keto carnivore. I mean, it starts getting absurd, to be quite frank with you. But when I'm approached with that, I always divert the conversation to fiber. In America, I'm sure it's probably like this in Australia, only 3% of Americans are even getting 25 grams of fiber. And really, in my view, you really should be getting anywhere from 30 to 50 grams of fiber for optimal health. And the reason it's important is that fiber is what feeds the 37 trillion bacteria in your large colon. I mean, most people don't realize you have about 37 trillion cells in your body, and you have 37 trillion bacteria in your large colon. And the other thing that's fascinating is only 1% of the DNA in your body is actually from your human DNA. 99% is from your gut microbiome. It is totally fascinating. And the reason it's so important is that these bacteria in the large colon, when you eat fiber, the fiber goes down to the large colon, and then the beneficial bacteria feed on that fiber, and they form what are called short chain fatty acids. The short chain fatty acids are propionate, acetate, and butyrate. And these are the most powerful anti-inflammatory, anti-cancer chemicals I have ever studied. They inhibit some of the most inflammatory chemicals in our bodies: interferon Y, nuclear factor kappa beta, tumor necrosis factor. And what is really fascinating, in fact, I did a video today that I'm going to be posting on my Instagram account in the next few days. But these gut bacteria actually control 70% of your immune function. And the way they do it is they send signals across the single lining of colon cells, and they basically conduct the immune system. They tell the immune cells where to go, how hard to fight. If the inflammation's getting out of control, they tell the immune system, hey, you need to back off. That's typically what happens with autoimmunity. The immune system starts getting out of control. And these bacteria basically conduct the immune cells and tell them, hey, guys, this inflammation is getting out of control. You really need to back off on this. The other thing that these gut microbiome do is they actually release 90% of your serotonin and 50% of your dopamine. And for those that don't know, serotonin is your happy hormone. When they give you an antidepressant, that's basically a serotonin uptake inhibitor. So if you look at most studies, people that eat more plant-based seem to have better cognition, and they seem to have better mood. And as I've studied the microbiome, it's really helped me tie in the whole idea of why people that eat more plant foods tend to have better health outcomes, not only from a cognition and mood perspective, but also from a cancer perspective, diabetes, Alzheimer's disease, really all cause mortality. So the gut microbiome is really like a critical aspect of scientific study. And one last thing that I think is totally fascinating is that when you do a fecal transplant, if you take identical twins, one is fat and one is lean, and you do a fecal transplant from the obese twin into a lean rodent, that lean rodent will get fat. And conversely, if you have a fat twin and you transfer the feces into a lean rat, it will get fat. And they've done this study hundreds of times. They've repeated it over and over, and you get the same outcome. And one of the reasons that happens is that the gut bacteria actually send a signal through these short chain fatty acids to the colon cells to release what's called GLP-1, a glucagon-like peptide. You're probably familiar with semaglutide. I don't know if it's popular, and I'm sure it is in Australia. Wegovy, it's really creating a lot of weight loss in patients with side effects, however. But those are GLP-1 receptor agonists. A way that you can do it naturally is by eating more plant foods, because as you eat more plant foods, you increase your beneficial bacteria. The GLP-1 goes up. GLP-1 decreases your appetite. It slows gastric emptying. It makes you more insulin sensitive. So I encourage my patients that I'm doing counseling for to eat more plant-based. And typically they all lose weight even without trying, because plant foods tend to be very calorically low, but nutritionally dense, as opposed to what the typical American Australian's eating, ultra-processed foods, which are calorically dense and they're nutritionally low in nutrients.
Wow, that's phenomenal in terms of what you shared there around fiber and the importance to the microbiome and how it conducts the immune system and how that's really important to preventing cancer. My next question is around probiotics. So you've mentioned the importance of fiber as a prebiotic to the microbiome. What are your thoughts on probiotics?
Yeah, I really think you're better off with prebiotics, and plant foods are prebiotics. When I make a recommendation for probiotics, basically I go to consumerlab.com. In fact, when I make any recommendations for supplements, I go to that website. And your audience should know about that website. It's called consumerlab.com. What they do is they go through all these different supplements and they actually analyze what's in the supplement. Just kind of give an example. I was using an olive oil that I thought was really good, Carapelli. And then when I went on consumerlab.com, I found out that 25% of it is rancid. And it was interesting. A lot of the olive oils didn't even have olive oil. The one that I recommend to my patients is Lucchini. They always have a top pick. So when I do microbiome testing through my website, Natural Insights into Cancer. And when that test shows that there's some dysbiosis, sometimes I will recommend a probiotic. And the one I've recently been recommending, I think it's called Physiobiome, was consumerlab.com's top pick. It does have I think it had like 250 billion colonies in there, and it did require to be refrigerated. So I do think they can be beneficial, but I don't think it's the cure-all. And some studies show that really even after a couple of weeks, a lot of those bacteria aren't even there. I mean, they've basically been destroyed either by the stomach acid or they just haven't proliferated in the large colon.
And in your book, you talk a lot about supplements that are really supportive in terms of preventing cancer. What are those top supplements that you would recommend to the listeners?
Well, what I tell patients, if they're going to take 3 supplements, I take 30 plus herbal supplements. I mean, I've highly researched them. And they're all in my book. I have over 500 references in my book, Beat Back Cancer Naturally. But not everybody is going to do that or can even afford that. But all the supplements that I do recommend, they can get on Amazon. I try to get the ones that are high quality, but also not that expensive. But the 3 supplements that I think everybody should take, even if they don't have cancer, one is turmeric. And turmeric has been studied in over 12,000 different clinical studies. And over again, it shows that it has very powerful anti-cancer activity. Alone, it has been shown to affect 80 different cancer signaling pathways, just to show you the power of turmeric. And what I typically recommend patients to do is find the turmeric supplement that actually is not standardized to 95% curcumin. Most of the turmeric supplements are, and they're the most expensive ones. The one that I currently recommend is through Carlisle, and basically it's almost all just turmeric root. The one that I recommend through Carlisle, each capsule has 1 gram. So the studies show that you need about 8 grams if you have cancer. Gollenbeck and their group, in fact, they're in Australia. They did some major work on MGUS, which is the precursor of myeloma, which is the type of cancer that I have. And what they found was that people that were taking turmeric actually had all of their MGUS myeloma biomarkers decreased by about 33%. Their M spike, their kappa chains significantly came down. So that's one supplement that I strongly recommend really everyone to take. If you're just taking it preventatively, I would do a gram in the morning, gram in the evening. The thing that all patients should take when they take turmeric is a black pepper extract. Studies show that you get a significant increase in bioavailability when you take a black pepper extract. So typically with cancer patients, I recommend 4 of those Carlisle turmeric and then 2 of those, it's called bioperine, the black pepper extract. And then I also recommend fish oil. The one that I recommend it's through New Age. It has about a gram, each capsule has about a gram of EPA and DHA. And the reason I recommend that is that for turmeric to be properly absorb, you need fat. So the fish oil provides that. But the other thing, the fish oil, the EPA DHA is extremely anti-inflammatory. And when you're battling cancer, you need to keep the inflammation down in the cancer microenvironment. So when you take 3 in the morning and 3 in the evening with the turmeric and the black pepper extract, that combination is very powerful against cancer. And one of the things I do in my practice is I do strongly recommend people to get their omega-6 to omega-3 ratio checked. I try to keep that about 2 to 1. Most people that I check, and for your audience that aren't familiar, the omega-6 and the omega-3 are both essential fatty acids. The omega-6 tend to be more pro-inflammatory. The omega-3 tend to be more anti-inflammatory. So what I typically recommend is to get that ratio checked. Most Americans that I check, it's anywhere from 10 to 1 up to 20 to 1. I mean, it's ridiculously high because of all of these ultra processed foods that we're eating. I mean, they are loaded with these omega-6 fatty acids. So typically when you decrease your ultra processed foods and then you up your omega-3s through foods, walnuts, for example, chia seeds, flax seeds have high omega-3 levels. But I really think by doing a supplement, it really helps get that ratio down to that 2 to 1 level that I really prefer my cancer patients to have.
So that's 2 omega-6 parts per 1 part of omega-3?
Right, okay. Exactly.
Fantastic. And just in terms of exercise, because we're covering all aspects of your book here, or parts of your book, but just getting a synopsis. So what do you recommend around exercise?
Well, exercise is extremely powerful. In fact, in my book, I have a study that's really quite mind-blowing. It's people that have had cancer, and one group walked briskly for 30 minutes per day, and they decreased their relapse rate by 24%. Then another group, they had kind of run 2/3 of a mile per day, and they actually decreased their relapse rate by 40%. And then the final group ran 2.3 miles per day, and they decreased their relapse rate by 95%, which is really, I'm not even sure chemo drugs can even do that. So exercise has an extremely powerful effect on your immune system. In fact, there was a recent study that just came out that showed just 5 minutes of exercise actually increases your natural killer cell activity. They're the cells that actually kill cancer cells by about 50%. So you don't have to do a lot. A lot of my patients will tell me, hey, I don't have time to exercise. And I say, you got 5 minutes? I think everybody does. In fact, I have a little band routine that I send to my patients. I made a video of it. And it takes me about 15 minutes to get through that. And I usually do about 4 reps. I hit every muscle group. And I just tell my patients, hey, listen, do 20 reps. You'll get through the whole thing in 7.5 minutes. You're out the door. You jacked up your natural killer cell activity. So you put yourself in a really, really good position. So exercise is really the kingpin of the lifestyle changes that I recommend. The other 2 in my book, one is sleep. I really think you need to get at least 8 hours of sleep per night. One of the things I started doing, I don't know if you've ever heard of the Oura ring. There it is right there. It's a sleep. I tell you what, it's really helped me a lot because I've been able to figure out some of the things I was doing improperly. And I'm getting very consistent sleep now. And one of the things that really fascinated me when I got the sleep tracker was if I was in bed for 9 hours, I was actually only sleeping 7 hours. Most people think if they're in bed for 8 hours, they got 8 hours of sleep, but you really aren't getting 8 hours of sleep. You're probably getting maybe 6.5 hours of sleep. And then the Oura ring tells you how much you're in deep sleep, how much REM sleep you're in, which is very important. And then they kind of make recommendations if you're kind of deficient in certain areas. And every day they give you kind of a readiness score. So that's something that has really helped me. But people need to realize when you are sleeping, that's when a lot of your tumor surveillance is going on. That's when a lot of your DNA repair is going on. And most people don't realize this, but by the time you get diagnosed with cancer, you have about 5,000 DNA mutations in that cancer cell. And by the time you relapse, you're up to about 12,000. So that's one of the reasons I strongly recommend a plant-based diet because it's very high in antioxidant power, helps keep those DNA mutations down. And when you get adequate sleep, you really need to repair that DNA. I mean, typically in a day, you get about 19,200 hits to your DNA. So you really need to give your body time to repair a lot of that DNA. The other thing is if you increase the fasting state that occurs during sleep, most people sleep about 8 hours. If you can increase the time that you're not eating, they call that time restricted eating. That gives your body more time to repair a lot of that DNA and also do what's called autophagy, where it's actually cleaning up a lot of unwanted proteins, cells that have been destroyed through cell suicide. So sleep is really important. But one of the things that I always say about exercise is when you're exercising, you tend to sleep a lot better. And then when you're exercising, you have better stress management. I mean, how many people have felt really stressed, went out for a jog, felt a lot better? So I always say that exercise is really the kingpin of the lifestyle changes because in itself, it has very powerful anti-cancer activity, but it really does help the sleep. And it also helps the stress management, which I think is critical battling this formidable disease.
I'm just thinking in terms of, as you said, when you were diagnosed with cancer, hit you for six emotionally. And I'm thinking that's obviously, putting a stress on the body. So how do you help your clients and patients through this emotional roller coaster so that they can better manage their stress and help, I guess, with their fight against the cancer?
Well, one of the things I do is through my website, after I do a 1 or 2 hour virtual consultation, I usually recommend that I have a 24/7 access to me through emailing, texting, and phone calling. And I really help a lot of patients through this emotional roller coaster. In fact, this past Sunday, I mean, I was literally texting with one patient for about an hour because she was just so anxious and I was just trying to allay her. Then I finally had to call her. What I typically do when they get to that point, I have a psychologist that I recommend that specializes in cancer patients. In fact, that's one of the things that I did initially when I got diagnosed. I had a friend of mine that also had multiple myeloma, and she recommended that I see a psychologist just to help me deal with the emotional turmoil, finding out you have a cancer diagnosis. And that helped me tremendously. I only had to see her 3 times. I think when you get diagnosed, it's the fear of the unknown. So one of the things I always tell my patients is, listen, wake up every day, live that day to the fullest, try to do something fun every day, try to eat healthy, and don't focus on what's going to happen down the road. Am I going to have pain? What's it going to be like? I mean, you might be down the road the next day and get run over by a car and you spend all this time worrying. So I just tell them, listen, really try to enjoy the day, pray, have a spiritual life, do something fun every day. Before I came on this podcast, I went out for a bike ride, so I do that just about every single day. But I try to do something fun every day, and I really encourage my patients to do that. Really try to enjoy your life to the fullest, and don't be thinking too far out ahead because it'll just totally freak you out. You're going to be thinking about pain and possibly having suffering and so forth, and that may never even happen to you. In fact, what's interesting, about 20 to 40% of cancer patients actually don't even die of cancer. They die of a cardiovascular event. And that's one of the reasons I really I always check their lipid profiles and so forth, because cancer patients are definitely more prone to cardiovascular mortality. So, all that worrying you did, you might go to sleep one night and have a heart attack and the whole thing's over. So, but I think the 24/7 coaching that I do really does help patients, get through this emotional turmoil because, well, obviously we all know we're going to die, but when it's right in front of your face, it's a totally different animal. You have to get your spiritual values in check. You have to get your finances. One thing that I did, any individuals that I was maybe a disgruntled relationship, I called them, I went out to lunch with them and I said, hey, listen, I'm sorry if I said this or that or whatever. So I just think it's a good time to kind of get everything in order. And if you have any areas in your life where, maybe you've crossed someone, it's a good time to maybe meet with them and just, apologize and kind of get things squared away.
That's part of the recovery, I'd say, given that, those sort of I guess, resentments or dislikes or arguments that you quite haven't got over or made up or forgiven the person, that would also be carrying some emotional, trigger within you that could be, exacerbating or worsening the likelihood of cancer spreading faster. So I could see that.
I mean, for sure. I mean, that definitely has a negative effect on your immune system, 100%.
I really, really appreciate the insight you've shared, Dr. Brandy. It's been terrific in terms of covering that holistic approach to tackling cancer. But as you said, doing it in parallel with conventional treatment, or at least getting some advice as to which conventional treatment will help in parallel with a holistic, plant-based, whole foods lifestyle, exercise, sleep, stress management, supplementation. So I really appreciate all your insights. You've added so much value to the listeners, because I'm sure they can share this with anyone they know that is, experiencing the challenge of cancer or know of someone who has cancer. So how can the listeners best reach out and connect with you?
Well, they can follow me on my Instagram site. I have over 96,000 followers on that. It's called Cancer Veggie Doc. And I've been posting for over 6 years now, and I do a post every single day. But every fourth day, I do a recipe video, which I think, when you're trying to eat plant-based, that can be a struggle. So I make sure that I'm always putting recipes on there. And then typically every fourth or fifth, I actually do a video on a different topic. So that's a good way that they can follow me. On my website is naturalinsightsintocancer.com. If you go on there, if you need a 1 or 2 hour virtual consultation, I do those, and then the 24/7 access to me through texting and emailing. And then I have different testing that I do. As I mentioned, microbiome testing, there's different toxin testing that I do. And then I have a 70 plus biomarker test that I do through Quest. I don't know if you guys have that in Australia. Do you guys have Quest labs in Australia?
No, not that I'm aware of.
Yeah, you probably, but that's primarily for people in the United States. So they basically go to Quest, they hand them the sheet that I print out for them. I get sent the results, and then I make recommendations to get different deficiencies in order. And one thing I will mention to your listeners is I have never had one single patient ever have their mineral profile come back completely normal. I mean, it's amazing how I've never had a molybdenum level ever come back even detected, which is interesting. A lot of these patients have low chromium levels, low iodine levels, low copper levels, cobalt levels. So when I see that, I make recommendations for various supplements they can use. But if somebody just wants to try to keep their mineral levels to proper dosage, if you go on Amazon, the brand Now, N-O-W, they actually have a colloidal mineral supplement that you can kind of add to your drink every day. And that should keep most of your minerals in a good position. So, but Natural Insights into Cancer, and then Cancer Veggie Doc, and then my book, Beat Back Cancer Naturally. They can get that on Amazon, or they can get that on my website. If they do get it on my website, I do send them a signed copy, and it is about the same cost as if they get it on Amazon. So
fantastic. And to the listeners, I'll include all those links that Dr. Brandy shared in the show notes. So just go directly to the show notes. You'll find those links. And again, Dr. Brandy, I'd just like to thank you for your time, sharing such great wisdom and insight with the listeners. And to the listeners, thank you for tuning in to another episode of Me and My Health Up. Please share it with those that you know that could benefit from this episode in terms of getting some natural insights as to how to complement their chemotherapy or their radiation or whatever medical treatment they're getting for cancer. Please pass this episode on to them, and I'm sure this will be of benefit and will certainly aid them in their, hopefully, recovery journey. So thank you, Dr. Brandy, once again.
Hey, it was great. It was a lot of fun. And
absolutely. We'll definitely get you back, Dr. Brandy. I really appreciate it. Thank you. Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited operating under the brand me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health Up.